Kwanza tuje tuzungumuze pamoja, na hiyo ndio sababu tulisema mambo ya kupigana tuache, tuje through dialogue we resolve our issues. Lakini wenzetu wa Kenya Kwanza walikubali mambo mengine, ofisi ya prime cabinet secretary, ofisi ya leader of opposition, ofisi za kina mama na zingine, lakini swala la gharama ya maisha walikataa. Nasi tukasema that is where we part ways.
Kina Robert wamepitisha kwa National Assembly na Senate wamepitisha, ile mebaki ni the bills anchoring this conclusion. Na hakuna jambo la kucheza. Wakijaribu kuharibu tena, wananchi wa Kenya wako na uhuru chini ya katiba.
Any pain you have in you is cause of one man called William Samoei Ruto.
Usiogope lolote. Adui yule mkubwa kabisa ni uoga. Uoga ndio the worst enemy.
Maandamano is not yet out because maandamano is in the constitution.
What you are seeing today is the beginning of a platform where we are saying we no longer can take this anymore.
Baba yuko hapa. I'll be around here. I'll be around here. I'm not going to be away. I will continue to ensure that things are working in my own country. I will work for the continent of Africa, but at the same time work for Kenya. I can be able to scale the
as the candidate of East African region, and this is the turn of this region. So I don't see any, will be a walkover. Raila Odinga will be the chairman of African Union Commission.
As you know that a candidate to be successful must get two-thirds physically, first round or second round. If you don't get two-thirds, then you're not elected. So I have to dialogue with virtually all leadership of the continent.
We want to work together towards the unity of Kenya, and that is important to all of us.
I've been running around trying to get support for different heads of states, and both of them agreed that they would support me. President Museveni said he would be the one to propose me as the chair of African Union Commission.
Baba, umepangaje? Umetupangiaje?
We hope you are going to be able to tell us that our children, my children, have held your hands. You know the potential of each of these children. What do we do so that even when you are away, we are able to hold fort?
They cannot be pangaed. Who can pangoa? Who can pangoa?
Kalonzo yuko hapo mbele na sisi tunashikilia pande hii. Lazima tuhakikishe kwamba serikali ambayo inakuja sisi tuko ndani na tumejenga taifa letu.
My friend Oparanya, there's Uncle Steve-O. Yeah, so we should not miss each other. And then there's nothing in Raila Odinga to miss.
But I'm not going away. Addis Ababa, as Charity said, is only 2 hours away from Nairobi.
So Baba endi mahali. Ako tu hapa. He's just around.
I'm available. Whenever I'm called, I will answer. I'm ready to work with you people.
Nataka kukuuliza Baba, tupange vizuri. You know, ulitupanga in 2002. You must panga us again.
You're unpangable.
Worry not, worry less.
We are also unpangable.
Kama unahitaji watu kubeba bag, niko hapa. Nitatembea na wewe Lagos, nitatembea na wewe Cape Town, tutaenda na wewe Kampala tena turudi, and across the continent.
Kenyans must know for sure from here that what you are saying is there's no vacuum, absolutely no vacuum. In fact, we have up to April for Raila Amolo Odinga to submit his documents.
Kuna mzee hapa ambaye anaitwa Kalonzo Musyoka. Na hatutaki yeye pia alale nje. Ama mnataka alale nje? Sisi tumeongea, tumesema kunaweza patikana pia commissioner ya East Africa. Naye Kalonzo aende akuwe commissioner ya wapi? Akuwe baba ya East Africa. Raila akuwe baba ya Afrika. Na Ruto akuwe baba ya wapi? Ya Kenya.
Hello.
Hello?
Hello.
Hello?
Baba ni mumo. Katika Kenya yote baba ni mumo. Our leader remains Raila Amolo Odinga.
Kwa hivyo watu ambao wanasema ati baba anatoka, sijui baba nani, wanahangaika, anasema ng'oo, baba yuko tu hapa. Na wakati ikifika, mkinitaka baba, na mkiniita, mtaitika.
As Commander-in-Chief, I will continue to provide strategic guidance so that together we can build a cohesive, united, progressive, secure, and stable nation.
We hope that the deployment will occur very soon because the people, they cannot move anymore.
The importance, significance, and urgency of this mission cannot be overstated. It is a mission for humanity. It is a mission in solidarity with our brothers and sisters in Haiti.
All right, that is a soapbox just to give you the feel and flavor of what has been in the public domain. Of course, we're not belaboring the point. As far as that is concerned, we'll just let it develop, and then we continue to give you the news as and when they come to hand. But looking at what is facing the country right now is this disaster of a doctor's strike that is looming, and they are going on strike if their demands are not met. According to the Standard today, Ministry of Health officials are hesitant to post interns who make up almost 30% of the workforce. As a key, or as the calls for dialogue grow louder, Kenyans will yet again bear the brunt of the strike. And also what we want to discuss as well is about IBC and the crisis where MPs were given to understand they are now pinched for time and they have to hire the IBC commissioners, or they have to actually start, we need not to hire, they don't hire, but they need to actually make sure that we have IBC commissioners in place within the next 3 months. If that does not really happen, then we're facing a constitutional crisis. So I know this is coming to the floor of the House. We want to get the latest development, as it were. But let me just give you the latest development as far as the doctor strike is concerned, because doctors in the country have postponed the strike that was supposed to start on Sunday night, that is March 10th. This is after key government health stakeholders invited them for a meeting to deliberate on the strike notice issued last week. On Monday last week, doctors, through their union, KMPDU, issued a 7-day nationwide strike notice that the government has till Sunday, March the 10th, to act upon their grievances. If not, all doctors in the country will down their tools. Among their demands is promotions, employment of more doctors, and study leave. Our reporter, Husna Mohammed, has that story.
The Kenya Medical Practitioners Pharmacist Dentist Union, KMPDU, has postponed the nationwide strike, which was to officially commence on the night of Sunday, March 10th to Wednesday, March 13th. This is after key health stakeholders in the health sector called a meeting expected to be held on Monday 10th to listen to the doctors' grievances. Last week, the doctors gave a 1-week strike notice that if the conditions are not met by the end of the week, then they will down their tools.
Healthcare workers, they have been on contract, and the contracts keep on changing, the salaries keep on dropping. We don't know where the money keeps on going. We will not sit back and watch the healthcare of this nation go down due to incompetencies of a few people. But as a union, as KMPDU, we are going to give a strike notice starting today, a 7-day strike notice that will culminate in shutdown from Sunday midnight.
The Doctors' Union, KMPDU, through the General Secretary of the Union, Davji Atela, say that if the meeting does not issue tangible solutions, they will strike. Among other demands are to be promoted, to get medical insurance, to provide jobs for medical interns, to be paid for the cost of higher studies, study leaves, and a pension from the government. The union has given the government an ultimatum that if over 1,000 medical interns will not be hired, they will down their tools, criticizing the Ministry of Health for refusing to absorb the medics and denying Kenyans quality medical services.
There are few people sitting in Treasury wondering that Why are you paying interns? Why can't they just work for free? Let them know that all interns, all cadres of interns are the backbone upon which the healthcare of this nation run.
If the demands are not met, Kenyans will be the ones who will be hurt, because all over the country, public hospitals, which are the backbone in the provision of health services in the country, will stop the provision of those important and urgent services. Husna Mohammed, KT News.
Right, Dr. Nyikali is in the committee of the medics, so to speak, in the parliament, or of health. You can actually just give us a premise what is really happening so far. Why has these demands not been met, and why are we facing this crisis? Why has the government really not given immediate action? These calls have been there for almost a month now.
Not just in the committee. I've been in this thing from 1981.
Before I was born?
Yes.
You in 1991?
81.
81, and you were in the medical. You were the director of medical services.
No, I wasn't. I was a medical officer then. I was actually a registrar.
But I'm saying, since you were also the medical director, director of medical services as well, you had an opportunity to rectify this.
Which I did. Not actually as a director of medical services. I actually did it when I was chair of Kenya Medical Association, before I became the director of medical services, and we had peace. Now he's made a comment there that the salaries keep dropping. Now there are fundamental issues that when governments change, people change things without understanding why they were there. That is about salaries before we come to about interns. Now, way back, as I was saying, in 1981 I was on this strike. And when I became chairman of Kenya Medical Association, we actually negotiated. And what the government said then, and I still hear that, was that doctors were part of the civil service, and therefore if they were given a different salary structure, it would destabilize the structure of payment. We had a long discussion. I think Professor Memo was then the director of medical services. And I think Dr. Ongeri was the minister, and also I think it was Haji. It was a time we had two ministers. And we said, doctors work long hours. With doctors, there's nothing like your shift is over. If there is still work to be done, you will continue. If you are in theater, you can't just walk out and say, now I'm leaving this serious section half done because my time is up. You continue with it. And therefore, it was agreed that they work long hours. That is a fact. They are exposed. If there are illnesses, contagious illnesses, infectious things. You saw what happened when we had the COVID. They are exposed. Even traveling, if they have to move at night. In those days, I think there were arrangements for their transport and so on. But these days, even those are not there. So if you are on call at night, you organize yourself. Even where you go and sleep in government, you don't even have a place to sleep, at least those days. So we agreed that if increasing their salaries would disorder or would cause instability in the salary structure, then we said, let's give them allowances to compensate them for that time, so that their basic salaries would be the same as in other within the civil service structure, but these allowances would compensate them. And that is where we brought things like non-practice allowances, extraneous allowances, risk allowances, and on. They were justified, but the bigger thing is they were actually compensating for the long hours they work, which could not be accommodated, because in 1981, what made people go to strike on that day was a senior government officer said, we employ you as other civil servants to work 8 hours, then you go and make duty rosters that make you work for 12, 24 hours, and you want us to pay. So we said, okay, tomorrow we are going to do 8 hours. It was chaotic. So those allowances actually kept a lot of peace from that time, and doctors actually were paid better. Doctors even moved from private hospitals to government hospitals. Before we did that, There were less than 700 doctors in government service, when at that time we had about 3,000 to 5,000 doctors. And the government advertised for doctors and got one response. That's how bad things were. So with those allowances, things improved. Of late, what people have come up with gradually, that why these allowances, why this? So these allowances have been removed consistently. And that's a really basic problem. So in terms of salary, that's a basic issue. Nobody's looking at why were they there in the first place. So that is in terms of the salary that they say keep. Then they go later on, I wasn't there then, they have these CBAs, these agreements. Then they reach the agreements, and because you want to stop the strike, you say we have reached this agreement, people go back to work, then you don't abide by the agreements. And that's the CBA that they're talking about. So there's an element of sincerity on how the health workers are being handled. Now let's come to the issue of interns. If you do not do internship, you will not be registered. And therefore, with your degree, MBCHB, you will not practice anywhere. That is international. That's not a Kenyan issue. That is international. Doctors do internships, some places called residence, and so on, so that they get registered. So if these guys, if they are not employed, it means they don't do internship. It means they don't register. They can't even go do private practice. They can't be employed in the private sector. Even if you think you want them to go outside the country, nobody will accept them outside the country because they missed that. Our colleagues may tell there's something a little similar, but not as drastic. People can have LLB.
It is very drastic.
But if they don't go to the Kenya School of Law, they'll never practice. Again, something that has always bothers me. So again, similarly, but these lawyers, on the case of lawyers, you can find them working in offices, doing the law firms, and so on. But doctors, where will they go? So internship is not optional. But many people want to see it as a training because you can't register before that. But when you have interns, if you go to a hospital that is structured, the first people that you meet are interns. And then the people who see you, they'll take your history, they'll treat you, and you go home, and they'll admit you. But if they have a problem, then they have to call the second person online. So they are part and parcel of the workforce. So the difference between them and registered doctors who are employed is that the registered doctors who are unemployed can work elsewhere, can start their practice, can go to another country. Them, they're stuck here. What would you do as a country? Really, you must make sure that these people are employed. And it is only at least 1 year. In our time, when there were very few doctors, you were almost sure that after you've been in internship, then they'll continue to employ you. My view is now, at least that 1 year they do. So that at the very worst, we as a country should put aside the money. And I think we look at it, even though we have done the BPS, we will have to look at it. I saw it being brought. I'm not sure the figures are not enough. Now, make sure that they do that. And once they have done that, if you don't need them, they can move and other interns come in. Because every year, the interns come in. But we may look for solutions if the government says we can't take all of them, but we must. We must. But we can then probably open it so that even private hospitals that are operating at a certain level and licensed at a certain level, what would be level 4, level 5, would then be said, you cannot operate at this hospital unless you have interns. And you'll pay them because you have the capacity to supervise them. So it is something that can be done.
I fail to understand because we in this country, we're talking about those interns. When we talk about the 4,000 unemployed doctors, are they inclusive of these interns? Or these are already registered doctors?
The full number, I think, about the interns who are out now, I think is probably about near around 2,000 or 1,500. I don't have the exact
So we have a figure of
so
4,000?
we have the 4,000 are now registered doctors who are not employed. The interns are
So we
part
have
of it.
4,000 registered doctors in this country who are not employed currently.
We have.
And then we have 2,000, almost 2,000, the figure of
I think
interns.
the 4,000 may include the interns.
All right.
So we have a large number of doctors who are registered but not employed. We have another category, the interns, who are not employed and therefore cannot be registered. It's a hemorrhage.
All right. So I fail to understand why we have, in a country where you're talking about lack of doctors, we have 4,000 who are unemployed. What is so wrong with the 4,000 who are unemployed in the first place? We are not even meeting the threshold of the World Health Organization as it stands, because I believe according to the WHO, it is 1 to 1,000.
Leave alone the WHO. With that one, we are not meeting. We are not meeting our own needs. Our own hospitals do not have enough doctors. There are doctors out there that are not employed. There are some here that are waiting even to be registered.
So what is the problem?
That's the problem is funding of the health sector and putting priority right. And also in terms of, particularly the interns, in terms of regulation, starting all the way from entry into the medical schools. We must look at what numbers we have. But you can't restrict that because people want to go. That's why I'm saying when you come, you should open it. Government must employ. Private, we can say private hospitals of a certain level should also be said. They shouldn't just wait until now these people are registered. Then they take them. They should take some and be regulated to employ and supervise them.
Okay, briefly, let's hear from
Thank you.
Hillary.
Dr. Nyikal has talked like a doctor. That is number one. Two, a practitioner, which I totally agree, because in the context of now the experience that he's had from 1981, he has a depository of knowledge and expectations of a medical practitioner and a doctor. The challenge that we have, which he didn't speak to, is what most of us have over time been talking about. The Constitution of Kenya devolves the health function. And however, he has a very good history of where we have come from and the experiences that he's had in terms of recruitment of doctors, the salaries they've been getting, the working conditions they have had, has over time changed. In 2010 now, when we had the new constitution and now the health function was devolved, this is where additional problems came in. And I believe if we were to start from there, a number of answers would be available to the issues bedeviling the health sector and the doctors. Believe you me, Dibal, every other employee would want the best in terms of working condition, terms of service, compliance with CBA agreements and all that, and salaries, because I can't be getting an X amount today and tomorrow I'm getting X less Y. It can never happen anywhere in the world where a reformation or a change of government or even a change of employer would justify a reduction in someone's salary. We can't. And if I got Dr. Nyikal right, one of the reasons why there has been a reduction consistent over time is because of non-payment of certain allowances, non-compliance and implementation of the full terms of the CBA, among other things that when you cumulatively deal with them, you will know we have agreed at 100%, 100,000 Kenya shillings a salary, for example, but this 100,000 has been broken down into a number of buckets of some sort. If then that is not paid, automatically you have not complied with the terms of the CBA, and I'm entitled as an employee to protest and exercise that right in the Constitution that tells me you are entitled to strike. The consequences of which sometimes some county governments have been able to sit down, negotiate, engage, and a return to work formula has over time been achieved, including now what we are getting today, because the notice was supposed to start today. But I believe over the overnight sessions and meetings that they have had, they have postponed it. As to whether or not they will agree on something, there is always going to be the challenge. Almost all the CBAs which are currently happening, KPMDU is the umbrella body. I know certain counties have independent CBAs with their health workers, if I'm not wrong, Dr.
I'll come to the county devolution element.
And so it's a whole convoluted factor. As regards the interns, if you don't get an opportunity to be interned, you definitely cannot become a doctor, for whatever its lack of a better description. Because internship is a program that graduates you to a registered doctor. It's the same example that you gave. You can be a holder of LLB degree, but if you haven't gone to get a diploma in law after your LLB degree, you cannot become an advocate. You will remain a lawyer. And the worst situation is when you haven't signed the bar, you cannot even be employed in the first place, because you are only employed when an employer or a prospective employer knows that Segei will be able to attend court, because an advocate is the only person who is licensed and certified to attend to a matter. So it is a stage that you must go through. If then the government is saying it cannot, it is completely then killing the dreams of thousands and thousands of trained doctors, because you cannot become a doctor unless you are registered. I know you do have an annual certification for purposes of practicing. Same case as lawyers. You must, on an annual basis, undergo some continuous professional training. We call them CPDs, out of which you earn points that will be part of the requirements for renewal of your certificates. Similar case then applies to interns. And so, where is the remedy? The remedy lies in the regulations and the leadership of our county governments, and of course at the national level with the ministry. The allocation that is provided for the ministry, remember, have been a point of contention. A number of governors are complaining. In my county, for example, Bomet, we have a problem. We have dispensaries across the country that are not served by professionals. Why? Because the county government has been unable to employ and retain. One of the things which I have picked over time is this requirement, which is one of the reasons why they are also protesting. They are entitled to, I believe, an annual leave or sometimes even training. I don't know the medical term they use.
Training.
Yes, where you are employed, you are on salary, and you are supposed to go out and continue expanding your knowledge and training. That has been the problem, where you have in the establishment, the institution, for instance, Longisa County Hospital, where in Bomet, for instance, you could be having a list of 10 doctors, but out of the 10, 5 of them have been allowed to go on training of some sort. What does that mean? We have a limited workforce. Even though the establishment reads 10, you don't have 10 on call, you don't have 10 present. They are not available to serve for the people. And that is still the entitlement, because as a doctor, that is a requirement. You must go for continuous training so that you are up to date and are able to serve the people as a medical practitioner. So it is something that we cannot sit back and say, let's wait and see, because health sector is very critical to every economy. Health sector is very critical to every administration. And so, even as we've struggled, because we are fighting, you've seen today in the papers, they've listed a number of counties where county governments are fighting with their senators over management and oversight of resources. Where we are saying we have sent out a lot of money. In this current government, there is no delay in disbursements. But when you go down to the counties, the health sector is terrible. Over the weekend, I got an opportunity to visit one of the supposed dispensaries in Bomet East constituency, and this is a ward called Kibreres ward, Cheleme, to be very specific. A dispensary that has been constructed for the last 10 years, the amount of money that has gone into that particular structure is worrying. And nobody is taking responsibility for it because, one, the contractor is not on side.
So
Two,
these are the
people,
stalled projects you're talking about?
The stalled projects,
Okay.
they are all over. And that boils down to now that person who is expected to be treated by that doctor in that particular dispensary, who hasn't been employed, who has not been paid, whose terms and conditions of service have not been complied with, yet the county government has been disbursed with resources within the health sector. It is a big problem, bigger than the strike that they are talking about.
We never seem to have had this particular problem when this was a preserve of the national government before. It seems now with devolution also, it has exacerbated the unemployment of the doctors, as it were. What does it really say? I'll come to you, Dr. Nika. Let me hear from Mr. Ruku, because first of all, we've seen the president just the other day commissioning the community health promoters in the spirit of trying to shake down the universal health coverage in this country. If this is what is the situation is on the ground, why are we even talking about the community health promoters and we don't have doctors on the ground at the end of the day? What are they doing?
Thank you, Depa. I think we are enemies of ourselves because we have county governments, and according to our constitution, health sector at the moment, it's county government are responsible for key management functions. Key management functions within the health sector, such as planning, such as budgeting, financial management, as well as human resource, and that's where the point which we are discussing at the moment, as well as provision of emergency medicines, and medical supplies. So medical supplies, it is in the purview of county government. Emergency medicine is the purview of county government. Human resource, taking care of our level 5 hospitals and level 4 and dispensaries. The national level 6 hospital is not at the purview of the county government. That is national government. So the question is, we have governors across the country. They have resources, they have money, they have CECs and directors, even chief officers. It's upon the governors to sit down and manage their work properly. And such a key function like planning is extremely important. A key function like budgeting is extremely important for our hospitals to be able to serve the Kenyans in the most appropriate way. So the question is, are our governors budgeting properly? Are our governors sitting down and do proper planning so that we may not have the challenge which the doctors are trying to say on a day-to-day basis? And not only doctors, nurses are critical in management of health facility, are extremely critical. Actually, all the dispensaries we have, I think, in the Republic of Kenya, are all managed by nurses. We don't have a doctor in any dispensary. In my constituency, at least I know all the dispensaries which are there. No qualified doctor who sit in those dispensaries. But medical officers like nurses, clinical officers are the ones who are available to see the patient. So for me, I think our county government are not doing what they are supposed to be doing in terms of planning, in terms of budgeting, in terms of financial management. Because you have been given a budget of, let's say, a county may be getting 7 billion Kenyan shilling or 8 billion Kenyan shilling. And I understand a huge amount of money out of that 7 billion or 10 billion goes to the health function. So you sit down and come up with proper financial management, proper planning, proper budgeting, so that they can be able to take care of the 5 years when you are a governor. Because you may not have enough resources now to pay all the medical supplies. but probably you can negotiate with the suppliers of this medicine or medical supplies to see how you can stagger their payment within a period of 5 years. Because you know for sure these resources will be available for you within the period you're in office. So you can be able to sit down with the suppliers for proper planning to ensure we have medicine in our hospitals, to ensure, and also the employment of doctors, the employment of nurses, because it's a function which human resource is an extremely important function. When we were studying human resource a few years ago, we were being told now is no longer human resource management. It's about talent management. It's about talent management. So you need to know you have a team of doctors, they are talented differently. And how do you retain this talent within your county, within your level 5 hospital? So you need to come up with strategies on how to retain the talent within your medical facilities.
But let's
so I think it's not even about the national government. It's not even about the president. It's not even about the minister in charge of health. It's about our county government. They have to put their act in order.
So I'm inclined to wonder then, should we call the development of medical services to have happened with the current constitution if the exchequer or the county governments, they are dependent on the exchequer to steamroll and fund, the facilities within the counties? Because it beats logic that now you've devolved these functions and still the exchequer or the national government is the one who's funding these particular services there. I think in the first place, then we need to just tell ourselves the national government is the one who is running the pass of the devolved healthcare in this country.
Let me tell you what's happening.
Because how then will you hold them accountable? They come and say, we have not employed because funds have not been dispersed from the national government. We've not put up, the structures and the medical facilities and the resources needed because monies have not been dispersed from the national treasury. So are we fooling ourselves as a country?
No.
That this function has been devolved, yet the one who's calling the tune is the national treasury of the country.
Well, the national treasury calls the tune for everybody in all areas. Eventually, money comes from there to go to everybody. But let me tell you,
that's what I'm saying.
The one thing, Dibal, which I'm happy about as a Kenyan, that on this issue, we actually always agree, even across the board, even where we're in the house. And even here, you can see we actually agree. I think that's a very good sign for the country. There may be just a few different, but let me say, the issue of devolution, I understand this because I've been, when devolution was starting, I was there. Now, health can be devolved. Health is devolved. It can work. The only thing which I think is affecting all other areas, but we are not seeing it because the other areas are not as noisy as health, is the adversarial relationship between county government and national government. I think somebody will have to come one day and realize there is no person who is only served by the national government or by the county government. The Mwananchi is being served sometimes by all of them. So both have to agree and help in the one area.
But what is facilitating this adversarial
I'm coming
relationship?
to that. You see, like when devolution came, we did the Health Act 2017, and we actually put in structures there that would actually help in putting a standard through which all counties will still employ, promote, and fire and so on, but in a manner that is the same across. It was a Human Resource Advisory Council. We recognize that. Even in the County Government Act, there is provision that in human resource, not only in health, there could be advice from the
But Dr.
public
Nyikal,
service.
we understand. We understand, although there are all those mechanisms.
No,
but they seem not to be working.
I'm telling you why they're not working. If you not, well, even if you let me only say
because
this
now you
thing,
go and belabor in the history.
No.
I don't want to go all through that annals of history.
Even if I only say this and I don't talk until this session is over, I'll be fine. So, but let's understand it. If now we talk of interns, now it is assumed now to be the role of the national government, and the national government pays them. But they are posted in counties. They are working for the counties. Many of them, if you expect those that are working in the referral hospitals. So sometimes in Kisumu last week, we were discussing, and the county people were saying, but you know, these people, it's a national thing, it is training. That's the concept that's not right. They are not training, they are working. The same thing is a problem with what he was calling.
So they're not training, the workings, they should not be compensated. That is
what the way they seem to think. So that's a misconception. The same thing with the issue of registrars. You were saying that these registrars, so look at that one. The national government is paying them, but they're working in counties. Look for the second one. Listen to the second one. These registrars, he was saying, Longisa, I'm the one who actually upgraded Longisa. So I know Longisa very well. So now, when people come for postgraduate training, then they will train in Kenyatta or in Moi or in Kenyatta University. They are working there as registrars, but they are deemed to be employees of the county government in Longisa. So county governments are paying them, but they're working in Kenyatta. Again, that is not right. So at that point, we needed to put a fund that just trains the registrars. And when they are away, they take leave of absence, but Longisa doesn't have to pay them. And that thing, even in the budget, it has come, it has been passed as a policy decision in the budget, but not implemented. Internship, I'm saying, and this is probably the first time we're saying, we should make arrangements so that where the interns are working, those people should pay them. That's why I'm proposing that even private hostels that are working at a certain level, level 5, should be told, you have to have as part of your staff this number of interns, because that will open a big employment. But everybody's waiting after the national government has trained them, now they want to employ them. So that is something that we should look at. So that is an issue of devolution, but if there was a structure that was working well, no, you don't like, I talk so much about structure, but that's why things are not happening. And I'll talk about it until people realize that without structure, things don't happen. So if you do the registrars, that will be okay. Now, when you talk about community health promoters, they are supposed to work at the lower level, and if they do work at the lower level, recognize diseases early, advise on healthy living, pick problems and small ones, deal with, so that they reduce the workload that is coming at the higher level. But we can do it even with revolution. Health can still work. The other thing I know that maybe I'll be going into too much details. Even now, at the Intergovernmental Relations Technical Committee, there's supposed to be a forum where CECs of that is
county executive committee member.
The executive committee members of health of the counties meet with the national government and agree on things. I'm saying here, if they want to correct me, that is not working.
Thank you.
Because even though health is devolved, the standards must remain the same. So that if you are being treated in Garissa, and if you are working in Garissa, your working conditions are the same as if you're working in Mombasa, and you are being treated in Mombasa. Those are available. So they are even written down solutions to this. Is that the government actually is worried of the amount of money that is going to be used. But this can be done. If they, and this I think is going to the committee on public petitions. But I think our committee will actually go and make a petition, and we'll make this suggestion. The BAL, it can be done. We did it 2003, 2008. Go and look at the data of the health indices. Look at them, what happened. So it can be done.
Okay, we need to wind it up.
It can be done.
It can be done. All right,
Yes.
it can be done. And I can see something that has been done as well in Parliament is that we have the legislators who have increased your budget by 2 billion shillings.
Yes.
Right? And you've changed the spending limits set by the Treasury for the financial years starting July 1st, 2024. Now, the reason that is being put here, because this was passed through the Budget and Appropriations Committee, is that you have increased the ceiling to 43.62 billion shillings after the Parliamentary Service Commission said it needed more resources to cater for the annual wage drift and the employer contribution to the housing levy. So you've increased that so that you may cater for the housing levy. What about other Kenyans who they have no, benefit or even that wiggle room to increase, for the employers to increase their salaries to cater for the housing levy? I thought everyone should suffer and feel a pinch as it is. So now you can't tell me your salary will be increased to cater for the housing levy. Isn't that being just selfish at the end of the day?
That is a budget policy statement.
Yes, it's a budget policy statement.
And what you are seeing there is merely a ceiling. It is not actually what is going to be the budget. The budget is still coming, and actually those figures can change.
Okay, so I wanted to know, when they say cater for the annual wage drift and the employer contribution to the housing levy, what does that mean? Let's hear from Hillary.
Thank you,
What does that mean? Because you're now hiding under the budget policy statement. No, this is what Nikal is trying to proffer here. It's just clearly that you want to increase this contribution to cater for that.
This is what I wanted to explain, and allow me to do it. The primary role of Parliament is to legislate. Everything in government goes through Parliament, from any policy to even budget itself, because it must go through the Committee on Budget. It must be approved by Parliament. What am I trying to say? If they are making a proposal to enhance from 42, to increase the 2 billion, sailing from 42 to, from 41 point something to 43, that's actually 2 billion, because I think that is what the budget policy statement says. It is a proposal that they're saying, look, for us to be able even to legislate on that affordable housing program, or on that additional housing levy, or on enhancing the services that goes down, it goes through a program. And we actually discussed this. I sit in the Senate Business Committee, and it came in as part of the proposal where we are saying Parliament is the Parliamentary Service Commission, the Joint Service Commission, right? And the National Assembly and the Senate itself. So it's 3 limbs. And we are saying if resources are not made available to committees, because one of the things that came out as a shocker is that committees were unable to transact business towards the end of the last session. Why? Because the resources were limited. If committees cannot transact, then nothing can happen. And that is one of the reasons why we said these committees must be resourced sufficiently for them to be able to transact the business of the House.
What nature of transaction are we talking about? Because I fail to understand. Yeah, it is not. This is not the only piece of legislation that you, as member of Parliament,
it is not
are working on.
I just wanted to read to you, for instance, the NADCO report the other day was presented before Parliament, right?
Yes.
And it went to the Capitol Hill, it went to State House, the National Assembly approved of it, and the Senate approved of it. There are 8 legislations which must be done. 8 of them, plus now the Constitutional Amendment Review makes it 9. Now, these 8 legislations must be processed. Processing of a legislation begins from a draft, it goes to public participation, it goes to now engaging stakeholders relevant beyond the public, and after that the committee now begins working on a report that will be presented to Parliament. I mean, that work is so massive that if committees are not resourced to sufficiently convene and do those programs, nothing will happen. In fact, even the budget itself that goes now to other government agencies and even to county governments will not be done. Remember the other day, the budget committee itself had to go around the country to collect views. In the decision that came from the court about the Affordable Housing Act, or bill, sorry, the court made certain findings. The Committee on Housing had to go out all the way across the country to ensure that it gets the support and comments from Kenyans. Indeed. So any additional proposal, Debal, is not mischievous. It is to make sure that Parliament can deliver on its mandate, because without resources, committees will not transact.
But I fail to understand, because this is why you're in Parliament, to make this legislation. So if you tell me that any additional legislation also comes
not necessarily any additional legislation. I'm saying legislation, any additional proposal in the budget is to make sure that that mandate is not hampered by insufficiency of resources. And it is a proposal for that matter. So it's not gone into that level where you're saying, why is it that you've done this and yet the rest haven't gotten an increase?
Well, I still don't trust what Hilary Sigay is telling me. I think he's trying to play some fancy footworks.
The most expensive thing now, actually, and it will be more as we really entrench it, is public participation. It's actually pretty expensive on committees, because the committees they call people, they have to move around, as you have seen. So that they need.
But I'm surprised this public participation is becoming an issue. We had the old BBI that we went all over the country, extending, and there was public participation. You never raised question about, raising...
No, the question of money was a big issue in BBI. And the question came, where was the money coming from?
And it was one of the reasons why the Supreme Court collapsed it.
So when you go and call people, you move around. That committees, as I said, actually, is the really working instruments of the assembly. When you see people in the plenary, some people have said that is show. Yes. When you see people in committees, that is work. And there are many MPs, you may not see them, you may not know them, but when you go to committees, you are amazed as how well they work.
Allow me to mention the previous discussion about health sector.
No, you want to go back? Okay.
Yeah, just a little bit, then I come to this. That health sector is one of the very key sectors, just like security, just like teachers, education sector, security sector, education sector, health sector are extremely key sectors which must be properly resourced for this nation to progress, to make good progress in terms of economic growth. And bearing in mind, COVID-19 taught us a big lesson that we are a very fragile society, not only in Kenya, but the entire world. Very fragile, very volatile. A pandemic can bring down a nation seriously. So health sector is more or less a security sector. And therefore, it is important for the government to invest highly in this sector. All the doctors should be properly utilized. To train one doctor take not less than 6 years. Serious training, and also it's extremely expensive training. The facilities required in our institutions to train a doctor are quite capital intensive. And this has been invested by the government. So let's utilize whatever is coming out of this kind of training. So proper planning is important. Just like in education sector, whether it's security sector, security is very, very key. We are allocating too much money, for instance, now to the National Security Intelligence Service, huge amount of money for the purposes of maintaining our security, maintaining law order in this country. So that's the kind of what I may call.
And the Balanam intrigued, but let me just support him. Why are we spending money on security? So that people don't die?
Yes.
Die. The same. So health is a security problem. Not just doctors, nurses, clinical officers, pharmacists. This we agree.
So sustainable financing is key, and that's why there are reforms. We passed several bills, and also we are looking at a number of regulations to operationalize these bills which we passed in Parliament in terms of the health sector. We're coming up with a new social health insurance fund instead of national health insurance fund. So we are working on all these regulations to ensure health is going to be stimulated in the Republic of Kenya, and every Kenyan will be able to enjoy services in our medical facilities. But having said that, our governors, our county government need to organize the act for people not to suffer, and not only people but also medical officers to be able to work in an environment which they can be comfortable and they can feel they are well remunerated and their interests are taken care of.
Indeed. Allow me just to take a short break, Mr. Ruku, right now that we are ticking up to 1 minute past 8. So we